Hello, Assalamualaikum warahmatullahi wabarakatuh. My name is Rakhmah Fauziah from Profesi Ners Poltekkes Kemenkes Semarang. Today, I want to tell you about diabetes mellitus. There are two main types of diabetes, type 1 and type 2. And the main difference between them is the basic mechanism that causes blood glucose level to rise. About 10% of people with diabetes have type 1, and remaining of 90% of people with diabetes type 2. Apart from type 1 and type 2 diabetes, there are also several other subtypes of diabetes mellitus, are diabetes gestational and other type of diabetes. Let's start with type 1 diabetes. In this situation, the body does not produce enough insulin. In type 1 diabetes, there is a genetic disorder cause a loss of self-tolerance among T cells that specifically target beta cell antigen. Loss of self-tolerance means these T cells are allowed to recruit other immune cells and coordinate attack on this beta cell. Loss of beta cell means less insulin, and less insulin means glucose builds up in the blood because it can enter the body cell. In type 2 diabetes, because of the tissue does not respond to the normal level of insulin either, the body ends up produce more insulin to get the same effect and move glucose out of the blood. As beta cells are lost and insulin level drop, blood glucose level begin to rise, and the patient develop hyperglycemia. Gestational diabetes is when a pregnant woman has elevated blood glucose, especially during the third trimester. Although ultimate unknown, the cause is proved to be related to pregnancy hormone that interfere with insulin action at the insulin receptor. Also, sometimes people can develop drug-induced diabetes or diabetes for which the drugs have a side effect that tend to increase blood glucose level. For other type of diabetes, this type of diabetes that is associated with certain disease or syndrome, such as pancreatic disease or removal of pancreatic tissue and endocrine disease, chemical or drug-induced infection, and endocrinopathy. The four clinical symptoms of uncontrolled diabetes that all sound similar are polyphagia, glucosuria, polyuria, and polydipsia. For type 1 diabetes, insulin is the only treatment of choice. For type 2 diabetes, on the other hand, lifestyle change, such as weight loss and exercise, along with a healthy diet and oral diabetic drugs such as metformin and some other classes, can sometimes be enough to reverse some of insulin resistance and keep it bay. Blood sugar levels are checked. However, if oral diabetic drug fails, type 2 diabetes can also be treated with insulin. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh. See you.